my name is Lovella de los Santos, and today I'll be doing an abdominal assessment. But to start, I'm going to do a room scan. Knock knock.
Come in.
Hello. I'm going to provide privacy and perform hand hygiene. Alright? Hello, my name is Lovella de los Santos, and today I'll be your nurse practitioner student. And before I start, I'm going to ask for your verbal consent. If you will allow me to record you on video and upload it to YouTube as unlisted so that my professor can view it and read.
Yes.
Perfect. Alright. So, can you tell me your name and date of birth?
Eliza Halapan, birthday August 6, 1999.
Okay. And how old are you, Eliza?
24.
24. Okay. And when was your last bowel movement?
Today.
Okay. And then did you empty your bladder?
Yes.
Perfect. Okay, can you lay down? Alright. So I'm going to put a pillow underneath your legs so that your abdomen can be relaxed. Okay? Then I'm gonna drape you for your privacy. Okay? And then I'm gonna pull this a little bit. Alright. Perfect. Okay. Alright. So, the first thing that I will need to do during abdominal assessment is to inspect. So, inspection. So, I'm going to inspect the contour of her abdomen. So, it's flat. There's no bulging of peristalsis. There's no pulsations. And the movement is within normal limits. And the symmetry is pretty much symmetrical. Alright? Now, I'm going to go ahead and check for the sclera of the eyes to check if there's any jaundice. Let me check the sclera of your eyes. Alright? So it's white, there's no jaundice. I'm gonna go ahead and check for the skin color. So it's not yellow, so there's no jaundice, and there's no bruising, there's no rashes, there's no scarring, there's no stria, and there's no dilated veins. Alright? So normally in a patient, if you see a scar, it will tell you a story that she or he might have a recent surgery or maybe a past accident. Or if you see a patient with a stria, like a silver old stray, it means that she just might have like an old stretch mark. But if you see like a pink purplish stray, it means that the patient might have Cushing syndrome, because that is the hallmark of Cushing syndrome. Now, if you see a patient that has dilated veins, it could be an indication that she might have portal hypertension from the cirrhosis, or could be an indication of superior vena cava obstruction. Alright? Moving on, I'm going to go ahead and do auscultation. So the reason why we need to do auscultation first before percussion and palpation is because we do not want to interrupt the normal bowel sound or bowel movement. So I'm going to go ahead and auscultate the 4 quadrants. So I should be hearing or listening to, I should be hearing clicking, gurgling, rumbling, or growling sound within like 5 to 34 per minute. And I will be listening on each quadrant for 1 to 5 minutes. So for the purpose of this video, I will just pretend that I listen for 1 to 5 minutes and check if there is a normal active bowel sound. Alright? So normal active bowel sound is that I will hear it within 1 to 5 minutes, and I will be hearing like bowel sounds within 5 to 34 per minute. Okay? Now I'm going to go ahead and start at the right lower quadrant. Okay? Alright, I'm listening for 1 to 5 minutes and I hear normal active bowel sound. I'm going to go ahead and move on to the right upper quadrant, listening for 1 to 5 minutes, and I hear normal active bowel sound. Moving on to the left upper quadrant, 1 to 5 minutes, and it's a normal active bowel sound. And then moving down to the left lower quadrant, I'm listening to for 1 to 5 minutes, and I'm hearing a normal active bowel sound. So what is a normal active bowel sound? It means that my patient has a normal, healthy gastrointestinal tract. So what if I hear like louder, more intense, or more frequent? It means it is a hyperactive bowel sound. So what does it indicate is my patient could have a diarrhea or gastroenteritis or maybe an early bowel obstruction. But what if I hear no sounds at all, or there is an absence of bowel sound? So it's called a hypoactive bowel sound. It could indicate a bowel obstruction. All right? Now I'm gonna go ahead and listen for bruits. So there are some arteries in our abdomen, and I will be auscultating first the aortic artery. All right? So aortic artery is normally located just right above the umbilicus area, like an inch above the umbilicus area. So I'm gonna use the diaphragm and bell of my stethoscope. I'm gonna warm it first by rubbing it, and then I'm gonna go ahead and listen for bruit. Okay, using the diaphragm of my stethoscope and switch to the bell of my stethoscope. I don't hear any bruit, but if ever I hear bruit in here, it could indicate an abdominal aortic aneurysm. And now so I don't hear any bruit. Now I'm gonna go ahead and listen for renal arteries. So renal arteries is located bilaterally, just lateral to from the aortic artery. So I'm gonna go ahead and listen on the right side of renal artery using the diaphragm first, and then switch on to the bell of my stethoscope. I'm listening for bruit, for some like turbulent sound or any vascular sound. All right, I don't hear any bruit. And then I'm gonna move on to the left side of renal artery. All right, using again my diaphragm and bell. I don't hear any bruit. Okay, now I'm gonna go ahead and listen for iliac artery. So with iliac artery, it's located just right above the inguinal ligament and then 2 centimeters below the umbilicus area. So I'm gonna go ahead and listen for iliac artery. So it's also bilateral. So I'm gonna listen on the right side of the iliac artery using the diaphragm first, and then switch on to the bell of my stethoscope. So I don't hear any bruit, and then moving on to the left side of the iliac artery. All right, and then the bell of my stethoscope, listening for bruit. Okay, there's no bruit. Now, if I hear bruit on renal artery, it means there's a renal stenosis. If I hear bruit on iliac artery, it could indicate an atherosclerosis. Now I'm gonna go ahead and listen to femoral artery. But for the purpose of this video, I'm going to listen to femoral artery with my patient's pants on, just for privacy and comfort. But ideally, you have to listen directly to the skin. So again, I'm gonna use the diaphragm and bell of my stethoscope to listen for bruit. All right, so the femoral artery is located just below the inguinal ligament on the upper thigh. All right, so I'm listening for bruit using the diaphragm first, and then switch on to the bell, listening for bruit. There's no bruit. Now I'm gonna go ahead and do it on the left side. So it's also bilateral. I started with the right and then moving on to the left. All right, I'm listening for bruit using the diaphragm first, and then again switch to the bell. So there is no bruit. So if ever I hear some bruit on femoral artery, it could indicate peripheral artery disease or any cardiovascular disorder. All right. Now I'm gonna go ahead and do a percussion. So I'm gonna percuss each 4 quadrant. So I should be hearing some tympanic sound. So the reason why is because our abdomen is filled with air. If I hear some dullness, it means there are fluids or some enlargement of organ. So I'm gonna go ahead and do it on the right lower quadrant first. So I'm gonna start with the right lower quadrant. All right, it's tympanic. Moving up to the right upper quadrant. All right, it's tympanic. Then moving to the left upper quadrant. All right, it's tympanic. And then now, moving down to the left lower quadrant. All right, it's all tympanic, so everything is normal. Now I'm gonna go ahead and listen to percuss the bladder. So I'm gonna percuss from the umbilicus area towards the pubic symphysis. So I hear tympanic sound. So since my patient has an empty bladder, so it's tympanic. But if I hear dullness, it means that my patient bladder is already accumulating fluid, maybe like 400 ml to 600 ml. So that's where you heal dullness. Now I'm gonna go ahead and percuss the liver border. So from the area of tympanic to the area of dullness, and from the area of resonance to the area of dullness. So I will percuss the upper and lower liver border to measure the liver span. So starting from the right lower quadrant, mid-clavicular, I'm gonna percuss until I hear dullness. All right. Now I'm gonna mark it. So starting from the area of resonance, okay, I'm gonna percuss until I hear dullness. All right, I'm gonna mark it again. All right, now I'm gonna measure it. All right, so it's 7 centimeter. The normal liver span measures 6 centimeter to 12 centimeter in the right mid-clavicular line. All right, so everything is normal. Now I'm gonna go ahead and percuss the spleen. So while percussing the spleen, I should hear no dullness. Why? Because if I hear dullness, it means the spleen is enlarged or there is splenomegaly. It could indicate some infection or maybe some cancer or certain cancer. So from the left lowest intercostal spaces, I'll percuss in the left anterior axillary line. So okay, I'm gonna percuss. All right, it's all tympanic. Now I'm gonna go ahead and ask my patient to take a deep breath and hold, okay? Take a deep breath and hold. All right, it's tympanic, so there's no splenomegaly, there's no enlargement of organ, it's all normal, okay? Now I'm gonna go ahead and do palpation. So I'm gonna start with light palpation. I'm gonna use one hand first to lightly palpate each quadrant. I'll start with the right lower quadrant, all right? And I'm feeling for any like tenderness, any guarding or rebound, any superficial masses. Do you feel any pain here? No? All right. Now I'm gonna go up and move to the right upper quadrant. Same thing. I'm feeling for any masses, tenderness or pain. Do you feel any pain? No. Then moving to the left upper quadrant. Any pain here? And then down to the left lower quadrant. Do you feel any pain?
No.
All right. So actually, light palpation, it relaxes the patient. It helps relax the patient for deeper pressure. So I'm gonna go ahead and do deep palpation on each quadrant. So from the right lower quadrant, I'm going to use my two hands and palpate it. Do you feel any pain?
No.
All right, perfect. Now I'm gonna go ahead and move to the right upper quadrant. I'm gonna do some deep palpation. Do you feel any pain?
No.
Perfect. And then moving on to the left upper quadrant. Do you feel any pain? No? Okay, perfect. And now I'm gonna move to the left lower quadrant. Do you feel any pain here? No? Alright, perfect. So there's no pain or tenderness. It means everything is normal. Now I'm gonna go ahead and palpate the liver edge or the liver border. So what I'm gonna do on the right upper quadrant, I'm gonna ask my patient to inhale. So this is liver with inspiration technique, okay? So I'm gonna go ahead and ask you to take a deep breath, and I'm going to palpate it. Okay, take a deep breath. All right. So I'm gonna push my hand inwards and then trying to palpate the edge of the liver. All right. Do you feel any pain here? No. Perfect. So if she feels any pain, it means there is some sort of like liver problem. Okay. Thank you. Now I'm gonna go ahead and do spleen with inspiration. So it's the same thing. I'm gonna ask my patient to take a deep breath or to inhale so that I can try to palpate the spleen. But normally and ideally, you should not be able to palpate the spleen. All right. So I'm gonna go ahead and ask my patient to take a deep breath. All right. Do you feel any pain? No? All right. So I'm not palpating any spleen. So it means there's no enlargement. If ever I palpate it, they normally call it inspiratory splenic palpation, and they normally use it in clinical diagnosis. But I was not able to palpate the spleen, so this is normal. You should not be able to palpate the spleen because the spleen is located underneath the rib cage. So now everything is normal. Now I'm gonna go ahead and do some special tests. So one is the fluid wave test, and this is to test for ascites. So on this case, I'm gonna show you how you do it. So if a patient has ascites, you suspect ascites, you will try to ask the patient to put her right hand in the middle of her abdomen, and then your two hands hold it laterally, and then one hand will tap, okay? And then if you feel some fluid and if you see some fluid waves and you feel it on the other hand, it means the patient is positive for ascites. All right, thank you. And there's another test for ascites. It's called the shifting dullness test. So that test, normally if a patient have ascites, if she's lying supine, the fluid is on the lateral side. So if you percuss it, it's dull. So, but if you let the patient switch laterally, can you switch to the lateral side? Yeah, right? If you let the patient switch to the lateral side and then you try to percuss, it becomes tympanic. Because why? There's no more fluid on this side. The fluid shift in the middle area and this one becomes dull. So if this happens, the patient is positive for ascites. So that's the shifting dullness test. All right, you can now go ahead and okay, lay down again. All right, now I'm gonna go ahead and test for Murphy's sign. So what is Murphy's sign? Murphy's sign is to test for cholecystitis or inflammation of the gallbladder. So the way to do it, I'm gonna ask my patient again to just exhale first, and then I'm going to deeply palpate it on the right upper quadrant. All right, and then take a deep breath. All right, take a deep breath. All right. So when I palpate it and she feels some sharp pain, it means the patient is positive for Murphy's sign. Do you feel any pain? No? All right. So there's no pain, so it means she's negative for Murphy's sign. All right. So that's how you test for cholecystitis. Now I'm gonna go ahead and test for appendicitis. So there's one test, it's called the McBurney's point. So from the right lower quadrant, I'm gonna locate the anterior superior iliac crest. So from the anterior iliac crest to the umbilicus area, I'm gonna draw like an imaginary line where they meet. So in between that area, this is the McBurney's point. So when I'll palpate it, and she feels pain, it means the patient is positive for appendicitis. Do you feel any pain? No. Okay. All right, perfect. So there's no pain, so she's negative for appendicitis. All right. Now the last but not the least test is the CVA test. Can I ask the patient to like sit up? And then, can you put your feet here so that I can show? All right. The costovertebral angle. So the way to locate the costovertebral angle, so you just find the 12th rib where the rib meets the spine, and then I will put my non-dominant hand and then tap it. Do you feel any pain?
No.
All right. Then I'm gonna go ahead and move to the other side. Do you feel any pain?
No.
All right. So she does not feel any pain. It means she's negative for any renal problem. And if ever the patient feels pain, it means there's some sort of kidney problem or some infection or UTI. All right. So I think that concludes our abdominal assessment. And thank you, Eliza, for your cooperation. All right. I'm gonna go ahead and turn this off.